Hello everyone, this is Biz Fashion Magazine here on site. We have a beautiful doctor here, Dr. Paulette Pillersdorf, and we wanted to do a little mini interview of her clinic and find out as to what she does. So welcome, Dr. Pillersdorf.
Thank you.
Where are we located? We're in Shepherd and Beecroft's location, right?
That's correct.
Can you give us the address so that anyone that looks for you, where they can find you?
So it's 40 Shepherd Avenue West in North York.
Wonderful. So I jotted a couple of questions that I wanted to share. If you can give us some more information as to what you do. It says that what are the most common types of sleep disorders and how do they differ from each other?
Okay, so I'm going to speak to what I deal with on a daily basis clinically. I'm a dentist and I get patients referred from apnea. They've already been diagnosed, okay, and obstructive sleep apnea, or they could have snoring. So snoring may be a separate entity, or if they have obstructive sleep apnea, then they may or may not snore. So it's a little complicated.
I love that. Okay, so what are the primary causes and risk factors that contribute to developing a sleep disorder?
So as far as obstructive sleep apnea goes, it's very common in the population these days. As high as 1 in 5 people could be affected by it. So there are various risk factors. Some of them are lifestyle. Obesity is one. One of the most common sites when people gain weight, that they gain fat, adipose tissue is in their tongue. With obstructive sleep apnea, what you have is people breathe normally during the day, but when they go to sleep at night, their airway can collapse in one or more sites. And the collapse can be total or partial collapse, so that they may totally or partially stop breathing at night. So one of the common sites of collapse is the tongue. So if you gain weight, you gain fat in your tongue spreads out, gets bigger, it gets higher in the oral cavity, and it can fall back and cause airway blockage.
Love that.
So that's one risk factor. Another one would be smoking, okay, because it causes localized inflammation and robs the tissues of oxygen. Alcohol, which can cause relaxation of muscles when you're sleeping, so that can also cause collapse of the airway. There are anatomical factors that come into play, like tonsils, big adenoids, people, which you see in children and in some adults also. They can still have tonsils that are large. They also can have very smaller, narrow airways. They can have recessive jaws, small jaws that are set back and can impinge on the airway. As you get older, you can have more issues in the general population with sleep apnea. Also, it's more prevalent in males than females, especially females may catch up to the males as they get older and get into menopause. It also tends to run in families. You can also be at risk for some disease states, like hypothyroidism. The tongue tends to, again, spread out and become more flaccid, so it can also block the airway.
Thank you. Very informative. So how can sleep disorders impact a person's physical and mental health over time?
So sleep apnea, obstructive sleep apnea, is directly linked to hypertension, cardiac issues, atrial fibrillation, heart attacks, stroke, as well as it can be linked to other systemic diseases like cancer, diabetes. Actually, there isn't one system in the body that obstructive sleep apnea doesn't impact, as well as we know through research that if you have severe sleep apnea and it goes untreated, it can take 10 years off your life.
And what diagnostic tools and assessments are commonly used to identify sleep disorders?
Right now, to diagnose sleep apnea, you would go to a sleep physician, and they can order either a home sleep test, or in Toronto, we're lucky we have a lot of sleepover clinics where they would do a polysomnograph. Then they would read the results of these sleep tests and consult with the patient to tell them what lifestyle changes and what therapy they require for this. So the two therapies that are the most common non-surgical ways to go are CPAP or oral appliance therapy. So what I deal with oral appliance therapy, not the CPAP part, and we do use adjunctive therapies along with the oral appliance therapy to get the best possible outcomes for our patients. For instance, some people have a much higher sleep apnea score if they sleep on their back. So we'll give them positional belts, suggest various pillows that will help them to sleep more on their side. Also, if you have nasal blockages, or if you're a mouth breather rather than a nasal breather, we can give you nasal dilators to help you breathe better when you're in bed at night. We also have a laser that we can use if you just have snoring or mild apnea. It may be appropriate treatment. So we can use the laser, and we also can use it with more severe apnea if there is unresolved snoring for people who already have oral appliances in that instance.
Wow. So what lifestyle changes or treatments are recommended for managing sleep disorders without medication?
Again, as we mentioned before, weight loss is usually, a patient is usually counseled at the physician's office. Exercise, weight loss, cessation or reduction of alcohol intake, cigarette smoking also. Good sleep hygiene is recommended, so you want to set a time where you're going to go to bed at the same time every night. You want the bedroom to be dark, quiet. Cool temperatures are better, between 60 and 68 degrees somewhere. Also, again, staying off your back is preferable. I always tell patients, whether they have sleep apnea or not, that is affected by back sleeping, to stay off their back, because some research has suggested that if you sleep on your back for more than 2 hours a night, then you have a higher incidence of neurodegenerative diseases like Parkinson's and Alzheimer's.
Wow, I didn't even know half of this. So how does stress and anxiety relate to the onset and severity of sleep disorders like insomnia?
So insomnia may be a separate entity, because some people will have insomnia, some people will have obstructive sleep apnea, and then some people will have both entities. So if you are waking up at night because you can't breathe, then that is an issue that is linked to the sleep apnea, and we can treat that. If you have insomnia for different issues, you're stressed, you're anxious, then you can have cognitive behavioral therapy, which changes the way your brain functions and will help calm the mind. Or you can use yoga techniques. Again, exercising during the day will also alleviate stress and anxiety.
Wonderful. So what roles does technology like screen time before bed play in worsening your sleep quality or contributing to sleep disorders?
So any kind of screens, whether it's an iPad or phones, they all emit, or computer, they emit a blue light. So when the brain sees this blue light, it interprets it as daylight. So there's a decrease in melatonin production, and that will negatively affect your ability to sleep. So you want to stay off all of these devices for at least an hour before you go to bed. The other thing is that they did do a survey in the United States where 91% of people said that because they were binge watching TV before they went to bed, it impacted on the number of hours of sleep they got. So ideally, you want between 7.5 hours of sleep per night, because that lets you get in 5 REM cycles. So if you start watching something and it takes away from that 7.5 hours, let's say, of sleep that you optimally should be getting every night, that's not a good thing.
Wow. So you do recommend the 8 hours that
Yes,
they say?
7 to 8 hours.
7 to
yes.
8. So nothing less?
Well, these days, not a lot of people get that much, but yes, that is ideally the amount of sleep that you should be getting.
Oh, wonderful. So I am so delighted to have you on our Instagram. We've had a lot of people online. I'm going to open it up to any questions that you can type in later on, and I can ask Dr. Paulette Pillersdorf, and then she can come back to you. Please look for them here in, at 40 Shepherd Street, Ave West, on the corner of Beecroft and Shepherd. Come and see her. She's really open to anything, like any questions if you have. The staff is amazing, and honestly, sleep is really crucial to our lifespan, right?
Absolutely. It is one of the 3 pillars of health that goes along with diet and exercise.
Yes. So please look out for it. If you have any questions, please type it along. Send it to me. I can go back to her. Send me your contact. Maybe she can follow up with getting back to you. Or come to the office and book a consultation. So is it covered under OHIP, or is this a private?
As far as being diagnosed through your physician, that would be covered by OHIP, especially if you are prescribed a sleep over PSG test. So that would be covered by OHIP. Oral appliance therapy at this point is not, but often our patients do have private health care plans that will cover partially.
Wonderful, great information. So thank you so much, Dr. Paulette Pillersdorf. I really, truly honor what you're doing. I think sleep is really crucial to our lives. And if you have any questions, please contact us or go directly to our beautiful doctor here. And we are going to do a segment in the magazine for next month. So we will have a QR code there to our 10K subscribers that get the monthly magazine, and connect with them and find out any information if you need anything.